My name is Randy Kojima from Pacific University, and I have the pleasure today of being able to introduce you to using the Ampleye Scleral Lens from Art Optical in combination with the Medmont E300 corneal topographer. In other words, how do we use the instrument to help us with Ampleye fitting, as well as how do we better understand the Ampleye design, its various zones, and the modifications through the Medmont contact lens software. So let's start with the case. Here's a patient that obviously has keratoconus, but is this somebody that requires a scleral lens? Is this somebody that we could think about fitting in corneal GP first? Well, how do you determine when it's a good corneal GP candidate and when it's a good scleral candidate? One of the first things you want to do is go to the elevation map. Click on display and then the pull down and find elevation. We're going to switch from an axial or tangential view to the height view, the elevation view. Now you're going to click your cursor in this deep red, the high elevation of the eye, and read the elevation here, plus 126 microns. Over here, plus 128. Over here, plus 141. So there's a high elevation of approximately 140 microns toward the superior cornea. Heading toward the inferior in this deep blue, we find the low elevation, minus 159 microns. Here, minus 156. Over here, minus 147. Now, across this meridian, it appears that we have in the neighborhood of positive 140 microns elevation down to minus 160. So a difference in height of 300 microns. Studies at Pacific University show us that when the elevation differential is greater than 350 microns, that's where a scleral lens is really a better choice. It will have a higher success rate than choosing corneal GP. However, when the elevation difference is under 350, in other words, when the asymmetry of the eye is low enough that we're under 350 microns of height change, that's where a corneal GP can be successful around 88% of the time. Now in this case, the eye comes up 300 microns of elevation change, so we should try a corneal GP. However, assuming that you had been down this path with the patient and we weren't able to achieve the comfort, the centration, the fit, the consistent vision, then Ampleye would be a great choice to vault over top of this irregularity, to take out the fact that the eye is high here, median, and exceptionally low. There's this asymmetry to the height of the eye. Using the Ampleye scleral lens will make it easy to deal with this asymmetry. Now you'll notice we have a topography that gives us approximately 10 millimeters of information. A single Medmont capture gives us a very large area of coverage, and that's why it's favored as one of the best specialty contact lens topographers. However, if we're trying to understand the entire anterior chamber depth to build an Ampleye lens, we really want to fill in as much of this visible iris as possible so that we can best predict the depth well into the sclera. So that's where you use the unique Medmont feature called the Composite Map. The Composite Map will fill in all that space out here by allowing us to capture all the data points as far out on the cornea as we possibly can. So in this case, we took a second capture, the Composite Map, and now we've filled in this peripheral cornea, and we can best predict the initial sag that we need. So one of the things you might do is go over to your attributes window and make sure that you have your estimated height chord attributes selected under the arrange icon. You simply pull down on this list, find your EH attributes, and then highlight them and click this arrow to move them over to the main attribute window. Now, once they're there, you can assess the height of the cornea across a specific chord of contact. In other words, I can look at the depth of the eye across the 0, 180 meridian, the first attribute, the second one, 150 and 330 degrees, and lastly, 30 degrees and 210 degrees. So let me try to make more sense of this. An Ampleye 16.5 lens lands at 15 millimeters diameter. Its sagittal depth is measured from that chord of contact, that chord of bearing, that point of greatest and heaviest landing on the eye surface. So Ampleye 16.5, you want to select a chord of 15 millimeters. If you were using the Ampleye 15 millimeter lens, then you want to subtract 1.5 millimeters or a 13.5 millimeter chord. If you're using the Ampleye 15.5, again subtract 1.5 millimeters, giving you a 14 millimeter chord. If you're using the 16.5, subtract 1.5 millimeters, we get the 15 millimeter chord. Now this is a keratoconic patient, so clearly in the more bulging and irregular eyes, we want to favor the larger diameter. Bigger diameter, bigger vault over that irregularity. So we've set the chord at 15 millimeters, and we look up here at the estimated height across the 0, 180 meridian. And it's coming up as 3,960 microns, or 3,961 microns. The Ampleye fitting guide suggests to us that we want an apical clearance on application of 250 to 400 microns. So that means we want to add a minimum fluid layer of 250 microns on top of this 3,961 microns, giving us approximately 4,200 microns in height, or higher, of 42, 43, or 44, somewhere in that range, to be around 250 to 400 microns of fluid layer when the lens is applied. So based on this sagittal depth, I'm going to pull out of my Ampleye set a 4,200 micron minimum sagittal height, or possibly the next steeper or higher depth lens. So this can be a manner that you can choose your initial Ampleye scleral lens very fast and efficiently. Simply take your composite map, go to your estimated height attributes, set the chord appropriate for the Ampleye diameter you're going to use, and assess one or all three and average these sagittal depths out, and then add in the fluid layer. Remember, 250 to 400 microns of fluid layer on application of the lens. That's what we're targeting. So that's one of the methods that we can use. Another one is we can use the Medmont contact lens software. And to do that, we want a composite map first and foremost. But then second, we want to define the visible iris diameter. To do that, go up to display and uncheck color so you can observe the visible iris diameter. Then go to annotate, select iris, and take this little circle and drag it out to the point where you land on the borders of the visible iris. So find a spot that looks as close as you think you can be, and if necessary, release it and then move that circle, click on the circle, and center it to the visible iris if your circle wasn't immediately perfectly centered. Then once you release it, it'll give you a VID. In this case, the estimated diameter is around 12 millimeters. Now, why is this important? Well, one of the things that we want to consider is to have enough real estate beyond the sensitive limbal area to land our lens. A rule of thumb is to look at visible iris diameter and add 3.5 millimeters. So we have a 12 millimeter visible iris. We should probably be in no smaller a diameter than a 15.5. If, in other words, in order to have room to clear the limbus and protect the limbal stem cells, the diameter of the scleral lens needs to be at least a certain distance away from that particular measured visible iris. So visible iris plus 3.5 millimeters gives you a ballpark of where you may want to be in initial lens diameter. Now let's put the color back on by going to Display and click Color. Then let's go to Home and Contact Lens, and let's drop a Ampleye lens on in the contact lens software. So here under Manufacturers, make sure that you have Art Optical selected, then click OK. And then under your design file, you'll have the various Art Optical lenses available to you. The Ampleye 15, the Ampleye 16.5, the Quad, and so on and so forth. Let's select the Ampleye 16.5 because we're dealing with the keratoconic condition. More irregularity, go larger in diameter. We'll click OK. And then the contact lens software will place the lens on eye. Now, what you're looking at is a theoretical fluorescein pattern, and it doesn't exactly look the way we would expect a scleral lens to appear. So there's a few things we want to adjust in the software right off the bat. The first is the scale. If your contact lens software is set for a corneal GP, it goes from 0 to 100 microns in tear film thickness. And a scleral lens like the Ampleye is fit with hundreds of microns of fluid. So you want to adjust the scale by clicking on this button here where it says Standard Fluorescein and adjust that to Extended Fluorescein. Extended Fluorescein gives you a range that's well within how we would fit a scleral lens, from minus 100 microns roughly of settling to 500 microns of fluid layer thickness. The second thing that you want to do is you want to uncheck the toric. The Ampleye 16.5 is a toric back surface, and that's designed to best align to the asymmetry and the toricity that most patients' scleral shape has. So if we drop on a toric in the contact lens software, we can't be 100% certain where the lens will rotate to, what axis that toric will find on the toric surface of the sclera. So in other words, it's much easier to uncheck the toric and determine what is the high point in the surface of the eye, and then that will help us to best choose our initial sagittal depth. Once you place your Ampleye toric trial on eye, it's going to determine where the flat meridian of the sclera is. In other words, it will rotate to the axis that it best matches and be rotationally stable. But in the contact lens software, let's just place a symmetric on eye and come up with initial sagittal depth. All right, now we've placed the lens on eye, we've unchecked the toricity, and now we're going to look at the tear film clearance. It says 463 microns. As we mentioned earlier, the Ampleye fitting guide suggests to us that we want between 250 and 400 microns of apical clearance, and we're at 463. So let's choose a lower sagittal depth of lens. Let's go to the sag depth box here and change our depth from 4200 to 4000. Or as you can see, you can select any one of the Ampleye sagittal depths in the 16.5. Well, in this case, let's take our 4200 and go down 200 microns to the 4000 micron and try to reduce this sagittal depth. Let's apply and see what apical clearance it gives us. Now we're down to 276 microns, very much within the range that the fitting guide suggests, 250 to 400 microns on application. Now, one of the things that we know in scleral lenses is they don't sit up high and proud on the tissue. They're going to sink in to the soft, spongy conge. So let's settle the lens, and the Medmont software allows us to sink and settle the ampullae into the tissue the way it might on eye. So let's settle the lens 125 microns, the average settling of an ampullae over a 8-hour period. Click apply and watch that lens sink itself into the tissue. So now we understand the kind of apical clearance and the corneal clearance after we've settled that lens. And it's down to 150 microns of apical clearance, and that's within the range that the fitting guides suggest. Post-settling, we want 125 to 275 microns of vault. And we have that. We're within that range with 150. And it doesn't look like it's laying itself down anywhere within the standard central vault zone. There isn't any darker shades here in the middle. So it looks like we have an acceptable amount of clearance. I'm going to take the axis line close to the horizontal here where we have these 2 points of thinning or landing of the lens. And I want you to observe the fluid layer here as we modify the various zones. I think at this point what we can say is a Ampleye diagnostic of 4,000 microns post-settling should be the depth of lens that we need. Maybe a 4,200 micron lens might be safe to assume would be successful as well. But we know the diagnostic lenses to start with that we should take for this particular eye. Now, if we wanted to make modifications to the custom, how does the Ampleye allow us to modify the fitting of the lens to create the best possible outcome? Well, let's use the contact lens software to best understand the various modifications we can make to each zone. If I click in the base curve section here, you notice the central area on the schematic lights up, your central vault zone. And this is essentially the optic zone of the lens. Now, we can modify the base curve if we want a little more or a little less apical clearance. In this case, maybe we might want a little bit more. So what if I steepen the base curve 1 diopter? I'll go from a 844 millimeter base curve, or 40 diopters, to an 823 millimeter base curve, or 41 diopters. So I'm steepening the base curve 1 diopter. When we apply, how much will it change this apical clearance? And you notice we go from about 150 microns to approximately 200 microns. So a 1 diopter base curve change in the ampullae equates to approximately 50 microns of sagittal change. So that gives you some perspective on how changing base curve will affect the central vault of the lens. And as we showed here in the schematic, when we change the base curve, we are altering only the central yellow area. You are only affecting the sagittal depth in the center. Let's put our base curve back to our standard trial lens base curve of a 4,000 micron lens and apply. We'll go back to our 150 microns of apical clearance. Let's click on the next zone, the peripheral corneal zone. Notice the yellow on the schematic lights up, the second zone in the lens. If we make this zone positive 1 step, we are changing the sagittal depth 25 microns. If we make this zone minus 1 step, we are subtracting 25 microns from the center. So if I'm trying to increase the central vault, one of the things I can do is increase the peripheral corneal zone 4 steps, 4 times 25, 100 microns sag change. So let's apply that change and see if it makes our 150 microns go up to approximately 250, which it did. And you see how it's made the fluid layer through the center much thicker. So by altering the peripheral corneal zone, you are increasing or decreasing the vault of the central vault zone. In other words, the second zone in the lens is like an elevator raising and lowering the center optic of the lens, or the central vault zone. Now we can go the other direction. Let's take it back to 0, and we'll go back to our 150 microns. What if we make the peripheral corneal zone minus? Now we are subtracting 100 microns. 4 times 25 is 100 microns, and we see we've dropped down to 50 microns, and we're getting exceptionally close to corneal tissue. So again, by altering the peripheral corneal zone, we're raising or lowering the central vault zone of the lens. All right, let's take this back to standard. Let's go out in the lens. Let's go to the next zone out in the lens, the limbal lift zone. And this zone is used to ensure that you have enough vault over the sensitive limbal area. Now you will recall that we defined the visible iris. And you can see that right here, this light blue versus white border right here, and on the opposing side right here. What you're defining is where the visible iris is and where we presume the limbus is. But here's where our touch is at this point and this point. So this Ampleye lens looks like an appropriate diameter because it's landing well beyond the borders of the visible iris. So this is a healthy limbal lift zone angle. Now we do have lots of limbal vault. What if we were to make the limbal lift zone minus? And just like the adjustments to the peripheral corneal zone, one step equals 25 microns. So if I make the limbal lift zone minus 4, that's 4 times 25 microns. I'm subtracting 100 microns. Let's apply and see how it modifies the vault through the limbus. And you notice it's decreased the vault in this area of the lens, but it has also affected the vault through the center 2 portions of the lens. So when we alter the limbal lift zone, that affects the vault through the central 2 zones of the lens. So this may be something we want to compensate for. As an example, if we wanted to ensure we were going to have enough vault when we decrease limbal lift, we could increase peripheral corneal lift by an equal number, and the 2 would offset each other, keeping the apical clearance the same. So we can make one go up and one go down to maintain that apical clearance. Now I have to be honest, I have rarely needed to decrease the limbal vault. I always feel more comfortable when we have more limbal vault rather than less. So erring on the side of protecting the limbus rather than erring on the side of possibly coming into touch. So the typical adjustment is to increase limbal lift zone vault, going toward the positive. But in this case, the patient had plenty of limbal vault. It looks unnecessary to increase. But you get the idea. If we needed more limbal vault, we could go up 4 steps and alter the limbal elevation. But if that was going to raise the apical clearance up too much, we could decrease the peripheral corneal zone, or we could alter the base curve as a compensation. Personally, I find it very easy to say I've got the right apical clearance, but I'm not happy with my limbal clearance, so I go up 4 or 5 steps in the limbal lift zone. I can go down 4 or 5 steps in the peripheral corneal zone, and the 2 would offset each other, maintaining the apical clearance. Now let's take our fit back to standard. And the last zone in the lens, the scleral landing zone, is used to increase or decrease the edge lift. And this is another zone where it's rare to make one particular modification. Just like I said, it's rare to decrease limbal lift, to decrease the vault through the limbus. It's rare to tighten up the scleral landing zone. It's more common to increase edge lift. And just like the other zones, when you modify the scleral landing zone 1 step, you are altering the sagittal depth 25 microns. So all 3 of these zones, 1 step equals a 25 micron sagittal change right at the center of the lens. Now, to make more edge lift, it's a minus adjustment. Now, why is it a minus adjustment? And the reason is when you increase edge lift in any contact lens, you decrease the sagittal depth. So for the Ampleye, whenever we're making a positive adjustment, we're increasing the apical clearance. Whenever we make a minus adjustment, we're decreasing the apical clearance. So in other words, to increase the edge lift, we want a minus SLZ adjustment. So for instance, if we take our 150 micron apical clearance and order a scleral landing zone -2, if it's blanching that's greater than or in the neighborhood of 180 degrees, it's not in just two opposing points, then we might order scleral landing zone -2. If we apply that, that should subtract 50 microns in sagittal depth, which it did. It took us from about 150 microns to around 100 microns. So adjustments to any one of the three zones are going to affect sagittal depth. And it's important to know what your starting apical clearance is to understand if I modify one particular zone, will that adversely affect the vault through the central cornea, the apex, over the diseased area if it's a keratoconic, over the host donor transition point if it's a transplant patient, etc. So if any of this doesn't make any sense, then the folks at Art Optical, the consultation team, they're absolute experts at the Ampleye and they're experts at the Medmont. So for any of your questions related to the construction of the Ampleye, talk to the experts at Art Optical. Their team understands this design. They know how to modify it to create the best possible outcomes. But the Medmont software can be used as this great tool to help you choose the initial diagnostic lens. And while you're learning how to use the Ampleye, you try these various zones. Alter each one to see how it alters this tear layer profile, to see how it changes the fit. Does it alter a outer zone? Does it tighten up the lens if I change the center? And you'll find that it doesn't. When I alter an outer zone, does it affect the inner zones? And you will find that it does. So I hope this video has been helpful to you. And again, I encourage you to reach out to the experts at Art Optical if you have any questions. Thank you very much.